Writing your first nursing resume can feel overwhelming, especially when you're trying to present yourself professionally without years of experience yet. But the good news is that a strong new grad nurse resume is not about looking perfect. It's about clearly showing your clinical experience, readiness, and potential as a future RN. In this video, we'll walk through how to structure an entry-level nursing resume, what employers actually look for, and practical ways to make your resume feel stronger and more confident as a new grad nurse. One of the biggest concerns many new grad nurses have is feeling like they do not have enough experience to build a strong resume yet. But employers already understand that new grad nurses are entry-level applicants. They are not expecting years of RN experience. What they are looking for is professionalism, clinical exposure, communication skills, and signs that you are prepared to transition into practice safely and effectively. Your goal is not to pretend you are an experienced nurse. It is to clearly present the experience and training you already do have. A lot of new grad nurses assume employers are only focused on years of experience, but that is usually not the case for entry-level roles. Employers already know you are a new graduate. What they are really trying to understand is whether you seem prepared to step into practice and continue developing safely and professionally. That includes things like your clinical rotations, patient care exposure, communication skills, certifications, professionalism, and willingness to learn. A strong new grad resume helps connect those experiences into a clear picture of your readiness as a future RN. One of the easiest ways to make your new grad resume feel stronger is to use a clean structure that employers can scan quickly. You do not need a complicated design. You simply want your most important information to be easy to find. A strong new grad nursing resume will usually include a clear header, a short professional summary, your education, clinical experience, certifications, and relevant skills. The goal is not to make your resume look fancy. The goal is to make your qualifications feel organized, readable, and professional. A professional summary does not need to sound overly formal or experienced to be effective as a new grad nurse. One common mistake is trying to force experience that is not really there yet. That can make a summary feel generic or disconnected from your actual background. Instead, focus on your clinical training, communication skills, professionalism, and readiness to continue learning as a new RN. A strong new grad summary should feel honest, clear, and aligned with where you are right now in your nursing journey. One of the biggest mindset shifts for new grad nurses is realizing that clinical rotations absolutely count as relevant experience. Instead of leaving your clinical experience vague, try to clearly describe what you were actually exposed to during training. For example, include the type of unit, the patient population, responsibilities you participated in, skills you practiced, EMR systems you used, and teamwork experience during clinicals. Transitioning your clinical rotations from a simple requirement into a detailed experience section can make your resume feel significantly stronger and more professional. Employers are not expecting perfection. They simply want a better understanding of the environments and responsibilities you have already been exposed to. Moving on, another area that can strengthen a new grad nurse resume is your certifications and practical skills section. This is where employers quickly scan for things that help show readiness for the clinical environment. Certifications like BLS or ACLS can help reinforce preparedness, while skills like patient care, communication, teamwork, prioritization, and familiarity with systems like Epic or Cerner help provide additional context about your clinical exposure. Keep this section clean, relevant, and easy to read without overloading it with unnecessary keywords. Finally, there are a few common mistakes that can make a new grad resume feel weaker than it actually is. Some resumes become too generic, some feel overly cluttered or difficult to scan, and others leave out important clinical details that could help show experience and readiness. Most of the time, small adjustments in clarity, organization, and specificity can make a much bigger difference than people expect. To wrap things up, remember that a strong new grad nurse resume is not about looking perfect or pretending to have years of experience. It is about showing professionalism, readiness, clinical exposure, and the ability to continue learning as you grow into your nursing career. Even small improvements in structure, clarity, and detail can make your resume feel significantly stronger. Your resume does not need to show perfection. It needs to show readiness. Finally, thanks for watching. If this video helped make the resume process feel a little clearer or less overwhelming, make sure to subscribe for more nursing career content, resume guidance, and practical resources for new nurses. You can also find the full blog article and additional tools at chartednurse.com. And remember, your resume does not need to be perfect to help you move forward. Keep learning, keep improving, and keep showing up. And with that, I'll see you in the next video.